And that should be reproducible. If you and I examine, both should come at the same conclusion. And it should also be a reliable test. So oral visual examination, when you do it several times, then you get that skill so that you're able to have a correct diagnosis in the first go itself. And if it has been seen that if you do oral visual examination every 5 years, then you can substantially reduce the incidence of oral cancer as well as the mortality due to oral cancer. Next, please. So what you need for doing that: adequate light, a dental mouth mirror, some cotton and gauze, and disposable gloves and a mouth mask. So next, please. And this is how you have to, open the mouth and look beneath the lips, the tongue, the side walls, and the palate. So this is the sequence of events that you should follow to do a proper examination. Next, please. Equally important is that you must note down the findings there and then, or if you have an assistant, you can always call out. So every time you have to follow the same procedure, like you will start from one end, go to the other, or you start from the lower or you go to the upper. So you have to follow your own set of procedures, but all these things have to be followed in a systematic way and the same way, like a tailor does the measurements. All tailors do different ways of measuring, but they have to measure each and everything. So similarly, you have to see each and every nook and corner of the oral cavity. Apart from doing the oral examination, you also to do the extraoral examination, which includes the face, head and neck, and also the lymph nodes. So the various lymph nodes which drain the oral cavity have been shown. There are various groups of lymph nodes. All of those have to be palpated on both sides, and you have to note whether they're increased in number or the asymmetry, they are tender or hard or whatever they are. So that way you have to note the lymph nodes as well. Next, please. So this is a diagram which shows the palpation of the various lymph node groups, the submental and the submandibular. Next, please. The periauricular, postauricular, occipital, postcervical, and supraclavicular. Supraclavicular is a very important lymph node which sometimes people miss. Next, please. Yes. So this is a chart which shows how the oral screening has to be carried out in the community, and when does the patient come to you seek the help of a dental surgeon. So everything in our community health cannot be done by the doctors. Sometimes you have to, most of the times you have to use the help of the frontline health workers. So here is the ASHA workers who are going to fill up oral health cards, and these are self-administered questionnaires also, which you can give if the person is educated. And then one can ask this history of these habits of tobacco, areca nut, alcohol, etc. And if they already have that history, then you can refer them. You should refer them to the cessation centers. And there can be a separate group of individuals who have known risk factors, more than 30 years of age or above, and then these need to be examined by a nurse in the first place or an A&M, and then if it is normal, then you can wait for another 5 years. If there is any abnormality, then one has to refer them to a dental surgeon, which is you people. And then you have to classify them whether they are normal or whether they have a potentially malignant lesion, or they are suspected oral cancer in the first place also, or they are clinically diagnosed frank cancer cases. And accordingly, you will then do the next steps. So this is a very systematic way of screening and then counseling the patient depending upon their findings with the oral visual examination. Next, please. Yeah, so I think this slide is very clear, and all of you must be, I'm sure, participating in the World No Tobacco Day. So it should not be just a day, it should be throughout the year.